All right. Can you please introduce yourself and about some of your education?
Sure. My name is Dr. Jackie Chambers. I'm a doctorate nurse practitioner and I work at Tucson Medical Center in Tucson, Arizona. I have 28 years as a registered nurse, 22 as an advanced practice nurse, and 18 as a nursing leader. My background is in critical care, trauma, emergency services, cardiology, neurosurgery, hospice, palliative care, as well as pulmonology and internal medicine.
All right. And how has COVID impacted TMC and the Tucson area so far?
Well, Tucson and Arizona became a hot spot similar to Seattle and the Washington area did when the first break came in November and December of last year. A second surge came through in February and continued through January of this year, and Arizona was hit probably twice as bad as the Seattle area, similar to what New York went through. So Arizona particularly lost a large amount of their elderly population, and because of Tucson and Phoenix also being what they call winter vacation spots where the snowbirds come down, there was a large population of elderly here that ended up having to isolate themselves. So because of that, a large amount of the population, there was a higher mortality rate here in the area than you most likely would have seen in a lot of the other states.
Are you seeing any successes in decline of COVID rates due to the release of the vaccine?
We are. So we have seen quite a bit of success with the vaccinations that came out in December and January of this year. Tucson Medical Center was the first and second hospitals in Arizona to collaborate to give out the vaccines. We gave over 100,000 in the first month. We also partnered with the Department of Health and Human Services so that they could send out clinics to not only give the vaccine to healthy individuals who had COVID, but also to give the infusion of bamlanivimab to patients who had the signs and symptoms, as well as who were very high risk, who required it, who were coming in that needed hospitalized. And it was very successful, and it was a model in which the health department came in, saw what we were doing, and then opened up their own clinic within our hospital based on our protocol. So we were very pleased with that. We did the first vaccine, Pfizer, and then we also did the second one. And as of this week, we are doing the one-time Johnson & Johnson vaccines in our primary care. So we're very happy. About 85% of our employees and physicians, nurses, as well as retired healthcare workers have been vaccinated, and we have opened it up to the public age 16 and older to be vaccinated within our community.